Australia's peak medical body says Queensland doctors have already started walking away from the profession over new employment contracts. If medical specialists don't sign up by the end of April, they could see their salaries cut by a third.
Dr Hao Tan has worked as an anaesthetist at the Royal Brisbane Hospital for 14 years, but the prospect of having to sign a new work contract has him and his colleagues ready to walk away.
The contract in its current form, I can't sign that contract as it is.
Well, I don't think I've ever seen any industrial negotiations around wages or conditions in Queensland where one part of the workforce or the other hasn't made particular threats.
Already I've seen a couple of major specialists take jobs in other states.
Queensland Health says the contracts, which would take effect from May, are meant to stop massive overtime bills and streamline the way private doctors are paid in public hospitals. Specialists say their concerns are about conditions, not money, and that it would make it easier for them to be sacked.
It's putting the interests of the administration and the managers above the interests of patients and their clinicians.
Costs of doctors are not the driver of healthcare costs. It's tobacco, it's alcohol, it's overnutrition and under-exercise.
The Health Minister says he won't be moved by threats of a walkout. If any doctors do leave the system, he says there are plenty more where they came from.
We're training a record number of doctors, and indeed many of those people will be wishing to work within Queensland Health.
When you wake up in the middle of the night in intensive care and you look up, you want the senior man looking after you.
The AMA says with changes, contracts can work, but Labor wants them scrapped entirely.
This actually takes away the enterprise bargaining rights.
Jeff Bruce, 7 News.